Introduction to General Anatomy and Medicine, Keith L. Moore. Contributions to Anatomical Education. Authored seminal textbooks, Clinically Oriented Anatomy, The Developing Human, used globally with translations in multiple languages. Pioneered a clinically integrated approach, embedding case studies to link anatomical knowledge to real-world medical scenarios, e.g., using brachial plexus anatomy to explain nerve injury symptoms. Emphasize visual learning through detailed illustrations and dissection guides, enhancing spatial understanding for surgical training. Role of anatomy in clinical practice. Surgical precision. Example, knowledge of the inguinal canal's anatomy reduces complications in hernia repairs. Diagnostic accuracy, palpating anatomical landmarks, e.g., McBurney's point for appendicitis. Interconnectedness. Case study, aortic aneurysm management relies on understanding abdominal cavity anatomy and imaging correlations. This lecture is presented by Ghulam Farooq, an AI technologist educator and producer of numerous medical channels covering major basic sciences, such as anatomy, physiology, biochemistry, and pathology, as well as key clinical disciplines including internal medicine, surgery, ophthalmology, and radiology, drawing upon a wealth of authentic sources to provide a rigorous and insightful analysis of the subject. This serves as a valuable source of knowledge for those pursuing their medical education. Foundational anatomical concepts. 1. Terminology. Standard terms. Directional terms, e.g., ipsilateral versus contralateral in stroke assessment. Plain sagittal for brain imaging, transverse for CT scans. Clinical communication. Mislabeling medial as lateral can misguide surgery, e.g., wrong site surgery prevention. 2. Body organization. Hierarchy. Chemical, e.g., electrolyte imbalances affecting muscle function. To cellular, neurons, cardiomyocytes. To tissue, epithelial barriers in COVID-19. To organ, hepatic lobules and cirrhosis. To system, cardiovascular interplay and sepsis. Body cavities. Thoracic, heart/lungs. Pleural effusion imaging. Abdominal peritonitis risks. Pelvic, endometriosis localization. 3. Skeletal system. Bone types, long femur fractures, short carpal tunnel syndrome, flat skull sutures and craniosynostosis, irregular vertebral disc herniation. Functions, hematopoiesis, bone marrow biopsies and leukemia, calcium storage, hypocalcemia and renal failure. 4. Muscular system. Muscle types, skeletal voluntary control and physiotherapy, cardiac, autorhythmic cells and arrhythmias, smooth peristalsis in IBS. Clinical roles, posture, ergonomics and back pain, thermoregulation, hypothermia management. Key systems and clinical correlations. 1. Cardiovascular system, heart anatomy, valves, aortic stenosis murmurs, conduction system, ECG interpretation of AV blocks. Pathologies, myocardial infarction, LAD artery occlusion, varicose veins, venous valve incompetence. 2. Respiratory system, structure function, alveolar surfactant deficiency in neonatal distress syndrome. Disorders, COPD, emphysemas, alveolar destruction, spirometry patterns. 3. Digestive system, GI tract, peristalsis and dysphagia, villi atrophy and celiac disease. Accessory organs, cirrhosis, liver synthetic function loss, pancreatitis, enzyme leakage. 4. Nervous system, CNS/PNS, stroke localization, Broca's area versus Wernicke's aphasia, peripheral neuropathy, diabetic nerve damage. Spinal cord, dermatome mapping and shingles, Brown-Sequard syndrome, diagnostic imaging, radiography, quick fracture detection, limitations in soft tissue contrast, e.g. missed ligament tears. CT, trauma triage, e.g. intracranial hemorrhage, radiation dose concerns. MRI, multiple sclerosis plaques visualization, contraindications, pacemakers. Ultrasound, dynamic assessment fetal anatomy, gallbladder motility, operator skill dependency, integrating anatomy and medicine. Recap, anatomy-informed surgical approaches, e.g. retroperitoneal versus intraperitoneal organ access. Importance, misdiagnosis reduction, e.g., distinguishing referred pain, cardiac versus epigastric, continued learning, 3D Atlas apps, VR simulations for virtual dissections, clinical problem solving. Case example, right lower quadrant pain to appendicitis versus ovarian cyst. Imaging CT confirms anatomical position. Surgical planning, prostatectomy nerve-sparing techniques relying on pelvic neurovascular bundles. Hope you found this lecture informative and valuable. Please share this knowledge with medical students to support their learning. If you would like a PowerPoint version of this lecture, feel free to request it in the comments section. Your support and encouragement for educators are greatly appreciated. Don't forget to like, share, subscribe, and hit the bell icon to stay updated with our latest content. See you in the next video. Thanks for watching.